It's 6:50 new this morning. More than 300 million people worldwide suffer from depression. And this morning we look at new therapies that are changing the game when it comes to managing that illness.
It's a disease that affects men and women, old and young, rich and poor. Depression does not discriminate. There are ways to help control it. Talk therapy, along with antidepressant meds, have been the go-to treatments for years.
Medications are not 100%. They provide some options, but they have some limitations.
In fact, 1/3 of people with depression don't respond to antidepressants. And when the drugs do work, they can take 4 to 8 weeks to kick in. Doctors are looking into new ways to help people when standard treatments fail. One method, called transcranial magnetic stimulation, or TMS for short, uses electrical stimulation to target areas in the brain that are underactive in people with depression.
What it does is it generates a very powerful magnetic field, which we can then target into certain parts of the brain to stimulate activity.
2 new FDA-approved drugs have shown promise. The first, esketamine. It's a nasal spray that acts within a couple of hours. It's derived from ketamine, which is used as an anesthesia during surgeries. Esketamine relieves symptoms in about half of patients with treatment-resistant depression. And brexanolone is a newly approved option for postpartum depression. It's given as an infusion over 2.5 days and starts to work within a few days.
Now, if you or someone you know is struggling with depression and has had suicidal thoughts, there are resources out there to help. The National Suicide Prevention Lifeline, available 24 hours a day for people who need to talk. We've got that number on your screen. You can also find it in the links section at tmj4.com.
Or just send a text or a call to a family or loved one who may be alone on the holidays. You never know what the difference that might make.
Absolutely.